Hi, my name is Brandy Rayna, and this is week 4, the thoracic assessment that includes chest, lung, and heart. So I will start with relevant medical history of cardiovascular. Do you have any heart problems?
No,
What about any abnormal heartbeat,
no,
heart rate?
no,
Have you had noticed any palpitations?
no,
Do you have high blood pressure?
no.
When was the last time it was checked?
May.
Okay. What was it?
Doctor said it was 119 over 79.
Okay. Have you ever had a heart murmur?
No,
Any swelling of your extremities?
no,
Blue skin?
no.
Have you ever had a heart test, like an echo or a stress test?
I've not.
Any heart surgeries?
No,
Okay. Have you ever had any chest pain?
no,
What about chest tightness?
no,
Breathing problems?
no.
Leg cramps? Okay. So, how is your mobility? Have you noticed any changes of walking?
Well,
Okay. Have you ever had a history of venous thrombosis?
no,
Have you ever had any redness, warmth, swelling, or pain of your extremity?
no.
Okay. What about cholesterol?
Doctor said it was normal to get a blood test back in May.
Okay. How are your dietary habits? Do you drink sodas?
No,
Do you eat a lot of candy or high fatty food?
no.
Okay. Activity. When was do you go to the gym?
Yes.
How many times a week do you go to the gym?
1 to 4 times.
Okay. How often are you there?
1 to 4 times a week.
I meant how long are you there?
Oh, hour or an hour and a half each time.
Okay. How much do you weigh?
175.
Have you noticed any weight change?
No.
Okay. Do you drink alcohol?
Yes.
When was the last time you drank it?
On the weekend.
Okay. How many times do you drink per week?
Once or twice.
Okay. How many times? How many per sitting do you have?
1 to 3.
Okay. Do you use illicit drugs?
No.
Tobacco?
No.
Do you vape?
No.
Are you exposed to secondhand smoke?
No.
Okay. So now family history, mom, dad, maternal grandparents, paternal grandparents, any history of hypertension,
No.
high cholesterol,
No.
stroke,
Nope.
heart attack.
No.
Okay, what about obesity?
No. My family is in pretty good shape.
Okay. So now for the um, lungs, do you have any lung problems or disabilities?
No.
Okay, what diseases?
No.
Have you ever had asthma?
No.
Um, have you ever coughed up blood?
No.
Okay. Have you ever coughed up sputum?
No.
Um, do you have any respiratory illnesses?
No.
Have you ever had pneumonia, bronchitis?
No.
Okay. Have you ever been hospitalized because of breathing problems?
I'm not.
Okay. Do you have any general allergies?
Seasonal allergies, but that's it.
Okay. What do you take?
Zyrtec, 10 milligrams daily.
Okay. What are the symptoms of seasonal
Red eyes, itchy throat.
allergies? Okay. No breathing problems?
No.
Hard to breathe? Okay. Um, let me see. Do you have any family history of respiratory diseases? Okay. Does anyone in your family use tobacco?
No.
What about family history of lung cancer?
No.
Okay. So now onto the cardiovascular assessment. I'm going to inspect your chest. So what I'm looking for is to see if his chest is symmetric, and it is. Next I'm going to check his neck. I do see pulses. Next is hands and nails. Both hands. I don't see any swelling or any abnormal findings. Going to check for capillary refill. Okay, capillary refill is less than 3 seconds. Now, lower extremities, I'm going to check both legs, knees, ankles, and feet, and I'll also check capillary refill. So, front, the side, check capillary refill. Also right, now to the left, there's no edema. Check for capillary refill. And the show less than 3 seconds on capillary refill. No edema or any abnormal findings. Next, I'm going to palpate. I'll start with his temporal arteries. Okay. I do not feel a thrill and is 2 plus as expected. Next, I'm going to check the carotid at a time. Okay. I do not feel a thrill. Next, I'm going to check the radial pulse, which is up here. I don't feel a thrill. It's 2 plus. 2 plus. Next, I want to check brachial. Don't feel a thrill. 2 plus. Also don't feel a thrill. 2 plus. Next, I will check femoral arteries. I don't feel a thrill. 2 plus. Next, I will check popliteal arteries, and which is behind the knee, and then I will go to the tibial, which is on the inner aspect of the ankle, and then dorsalis pedis, which is on the top of the foot. Left. On bilateral popliteal, tibial, and dorsalis pedis, I did not feel a thrill, and the pulse was 2 plus. Next, I will auscultate the carotid arteries. Okay. With bilateral carotid arteries, I do not hear a bruit. Next, I'm going to check for heart sounds. I will first start with the aortic, which is the second right intercostal space on the upper right sternal border. Sorry, right is right. Then I'll check the pulmonic, which will be the left, second left intercostal space. Then Erb's point, which will be right below that in the third left intercostal space. Then I'll check tricuspid, which will be in the fourth. And then I'll check mitral, which will be at the fifth intercostal space, mid-clavicular line. So for heart sounds, I did not hear any extra sounds. I did hear just the S1 and S2. Next, I'm going to check the abdominal aorta. The abdominal aorta, I will listen here. And then I'll check the abdominal arteries, which will be the right, renal, iliac, femoral, and then the left, renal, iliac, and femoral. I did not hear bruit in any of those areas. So next, on to respiratory. Again, I will inspect his chest. It is symmetric. Next, I'm going to palpate chest expansion. So chest expansion is equal bilaterally. Next, I'm going to do tactile firmitis. Okay. I did feel the vibrations throughout. Next, I'm going to percuss the chest wall. So I'm going to place my hand onto his chest and I'm going to tap my finger. So all areas are resonant. I did not hear or feel any dull areas. So next I'm going to auscultate his breath sounds. On anterior chest, I'm going to listen to right, upper, middle, and lower lobe. And on anterior left, I'm going to listen to upper and lower lobe. So on anterior lobes, all were clear. I did not hear any adventitious sounds. And upon auscultation of the posterior lungs, I did not hear any adventitious sounds. All lobes were clear. Still. So for the last one, it is bronchophony. So I asked him to say 99. I could hear the vibrations, but it was not clear. So bronchophony was negative. And that is it for the end of the thoracic assessment. Thank you. Again, my name is Brandy Rain.